You guys remember the Trendelenburg position when we used to keep the feet higher than the head in order to improve hypotension? Well, there's a reason it actually disappeared. Let me show you why. So in EMS, typically we use the modified Trendelenburg, which is the legs that are up and basically from the stretcher, and then it's going to allow for more blood flow into the central core. And that was kind of the idea, is that there was a lot of people that were reporting that there was an increase in blood pressure because there was an increase in blood return back to the core and increasing the preload, thus increasing cardiac output. So that was the key. So yes, does it increase blood pressure? How it does. However, there is only a transient impact, meaning that it only increases the blood pressure for a short amount of time. And the other thing about this is that it typically comes with a lot of complications. For example, a lot of strain on the heart itself, especially when we don't know the cause of the hypotension. By lifting up the legs and increasing more blood flow back to the core increases a lot of strain on the heart, which could increase pulmonary pressures, increase cardiac or ventricular pressures and afterloads, and which is probably not a benefit to these patients. So there is probably a patient out there that the Trendelenburg position will be a benefit from that has a low amount of complications. However, in our field, in EMS, there just really isn't a place for it, simply because there seems to be more complications than benefits for that transient increase in blood pressure.